Hi, I'm Mary Ellen Pratt. I'm the CEO of St. James Parish Hospital in Letcher, Louisiana. My hospital is a critical access hospital in southeast Louisiana. We're a rural community of only about 22,000 people. We serve, as typical in the rural space, an underserved population, an older, sicker, and generally poorer population. St. James Parish Hospital had the opportunity to replace our nurse call system. And in doing that, we really wanted to make a technological upgrade. One of the things we know in healthcare is communication gaps tend to lead to medication errors and sometimes patient harm. So we really wanted to enhance that by implementing computerized whiteboards in our patient rooms. These are digital boards that maintain the patient's care plan in a dynamic format so that as nurses are updating the patient's care, it updates in the patient's room, giving the patient information about what they can expect and what's to come next, as well as their family at home. We had some very specific goals that we were trying to achieve with this new nurse call system and digital care boards. One was we wanted to enhance communication and the patient experience from understanding their discharge instructions as well as their understanding of their care throughout their stay. The second objective was to really reduce harm by being able to monitor patients more closely when they were high fall risks by having visual observation. So our HCAP scores have had a dramatic improvement. The nursing communication score went from like a 79% favorable. After the implementation of these care boards, it went to 93%. One of the great things about these care boards is that we have video cameras embedded in them. And as a result, we can do some telehealth work, whether it is a specialist who may be not able to drive all the way out to our rural community to have a consultation with that patient, or maybe it's a family member that is living remotely and wants to keep up with the care of their family. One of the best things about this new system is the video capabilities. Our ability to have our patients and families so much more engaged. We've used this technology not only to connect patients during rounds and discharge time with their family, but it's also helped us have family visits for patients who have family that don't live close to us. So it's really, really helped us make that family feel more involved and engaged in the patient, as well as the patient having more opportunity to relate with their family. So we really think it's been great for the patient experience and engagement piece of it. And it's also been great for our staff to have better care coordination and communication across all disciplines of care.